ma'am.
Any pain?
No, ma'am.
Change your appetite? Is your
No.
seizures, you control them, or you have to go to the emergency room?
Medication.
Oh, you take your medication as well? Okay.
Yeah. It got really cold, and usually when it gets really cold, I have a seizure.
Oh.
And if the temperature like shifts really rapidly, and I don't like have the heater on high the whole time because it, you know.
So the cold triggers your seizures.
Yeah, it can trigger convulsions, and I've had some like interruptions between getting my medication recently. I just got it back, so like I'm not supposed to be off it at all. There's like a buildup, I guess, and I was off it for like a week. And so it catches up kind of. I mean, I'm not sure if it's exactly how it works, but it certainly has felt like that. I've only been really off of it and on it a few times now in the last like year or so, but because they were pretty consistent about making sure I wasn't off it. But like, it's a pretty, after this many times that it's happened, it's kind of seems like it's getting worse every time almost. Like maybe the first time I was off it for like 2 or 3 months because of issues, and then it wasn't that bad. But like now it's like I go less than a week and I'm already seeing symptoms. So.
Do you want to take your HIV test? I believe it's blood work.
Yeah, sure.
Okay.
Was I supposed to take that before I came here?
No. No. So what it is the reason why they asked it because it haven't been done over a year.
Yeah.
That's why.
Yeah.
Yeah.
Yeah. No. I probably need that for oncology. I'm sorry.
Okay. No change in appetite?
No.
Are your medications still the same?
Yes, ma'am.
Mandeville, the Walgreens?
Could I change, but that is just a secondary. I think the Mandeville Pharmacy should be listed there now.
Highway 90?
Yes, ma'am. I'd like that to be the...
Your primary?
Yeah.
Alright, I changed it for you.
Okay, thank you.
You in college?
You
in college?
Me? Oh, no, not anymore. I went to LSU, though.
Oh, nice. Take your arm off for me. Good luck. was 120. On just that phase, 128 over 87.
Okay. I think it's usually around there.
Oh, you say it's usually around there?
I think so, but I'm not sure.
I mean, it's in the normal range, so you fine.
Normal range? Okay, good.
Yeah. Alright, she'll be here with you shortly.
Hi.
How are ya?
Good.
The cold weather's here. I know that's a challenge
Yeah,
for you.
it is.
Tiana mentioned that you had a seizure and you had not had your seizure medication.
Yeah, I've been having difficulties about that and my medication in general over the last few months. When was the last time I saw you?
You saw me in May.
Yeah, that, like, right after that, there's been a lot of problems.
Okay.
Like, a lot.
Okay, so I know you saw...
I know it had been pretty smooth sailing for a while there. Like a year maybe of just consistency and not that many issues, maybe a year and a half almost.
Yeah.
But, well, I mean, besides the valproic acid for a couple months around this time last fall actually.
Okay.
But besides that, the addr hadn't been that much of an issue to get. I don't think. Well, it kind of worked out. It wasn't that bad. In the beginning of this year, there was a lot of months that it was kind of consistent leading up to May when I saw you last. But like just a week after I saw you, it's like a whole lot of stuff ended up changing with Medicaid. I found out later, but they didn't notify any. Well, I didn't know about it.
Yeah.
But that wasn't the cause of the issues. The cause was Walgreens.
Okay.
They were causing a lot of problems with denying patients just because of the messages that pop up for the quality control limitations that aren't actual federal limitations. Saying that the feds were saying that. They weren't very happy that they were doing that, but they were just doing it at very random because the pharmacist was denying me in May, the week after I saw you, and she was the same pharmacist who filled the script at that same location earlier that month, and was surprised to hear that from me when I told her that on the phone. But so I took my script to another Walgreens location, and then that pharmacist filled it. But then the following month, I couldn't go to Walgreens anymore because they had basically worked it out internally that because like one of them screwed up, the other ones can't just keep covering for them, especially not when I have to go all the way to Abita from Mandeville.
Yeah.
It's like that's a pretty far distance, and there wasn't any reason to deny me the first time, and it's like so. And anyway, in the second pharmacist, they were very amiable. So I mean, but there's just a lot to ask. My father had to drive me out there and stuff, and things haven't been really going well with my family, so they just stopped driving me to the pharmacy and things. But that probably didn't help. Was while he was gearing up for his Social Security case and things for his Alzheimer's, to all of a sudden have his son's medication stop coming in and like his seizures get worse and things. That wasn't good at all. And so I was able to move everything to Mandeville Pharmacy just in like August and September. And I think I've now got that consistently set up. So I asked the nurse when she came in she changed the the default status. So I need everything sent there basically from now on because I can't go to Walgreens.
And that's what we've got.
Walgreens is like the backup just in case Mandeville Pharmacy tells me that I have to go there for something. And we'll just go back to how it was back when I was on the interferon with using Walgreens for that.
Right, we can do that. And that is listed now.
Okay. And I wanted to ask if there was anything pending that they had sent from Mandeville Pharmacy to y'all for prior authorization. They spoke to me about that like 2 weeks ago, or a week and a half ago maybe.
See if I have any requests for you.
Last week, I guess. Because if I could get like a paper script from you just in case, I could get that. I could hand that to them today because I actually have a scheduled stop at Mandeville Pharmacy.
I don't have any refill requests on medications for you.
Are you able to access the ones from Derm because they need a prior authorization to be handled now for one thing from them? So since you're my primary care physician, I think you can probably do that.
Let me.
Because they just need to speak to the physician or have like
So you need a prior authorization for your dermatology medication.
Possibly, but they may have just written the script and like pushed it through and not have actually since they were medical students, not have actually like had the full authority you do.
Okay, so I see the clindamycin.
And they
and
might not have, the experience with the system.
And the benzoyl peroxide, are those the two that you're having trouble getting?
I'm not sure which one it was, but I was hoping it would like indicate or something.
It does not. I can have my nurse though call the pharmacy and see which medications
Okay.
are, that they're having trouble with, and then we can kind of sort out the best way.
Okay, because they were, yeah, because I know it'll be covered.
So what did they tell you? What did the pharmacy tell you?
They were able to reduce the price, and it showed like coverability, but they needed a prior authorization.
But we don't know for which medication.
I just don't remember what they said. I wasn't really feeling well. I didn't have my I was picking up the valproic acid that day and the Adderall, and I hadn't had it for a long enough time where I was kind of not really at.
We will call over there and find out.
Okay. They probably be open soon, I think.
Okay.
And there wasn't anything else that I had asked about before to send over to Walgreens that you could just transfer there right now? Like that's on our records?
Yes, I will send the rest of your...
could you write me a new script for the I know I asked about it a long time ago, but the lidocaine shoulder patch thing?
Yeah.
That.
No problem.
Because I need more of those. When I moved, I disposed of the other ones because they were expired. But if I'm gonna be lifting weights again, I have to have that again. That was just like a very low priority thing for me to get filled, but I remember that was like some back and forth that it took last time, so it'd be good to just get that done today.
Yeah. And then I'll transfer your medications from over to the Mandeville pharmacy. That's no problem. We can do that.
Can I have a printout for a script too, or something, so I could just like hand them
So
something as well?
We don't want to do both. So
because it would like cancel it out.
I can give you paper, or I can send them electronic.
Are you sure they have the electronic
I have no idea. I assume they do if they're in Epic and we can send it, electronically.
Does it look like? I don't think we've done that before yet.
All pharmacists, I cannot imagine that there's a pharmacy in 2024 that only takes paper prescriptions.
They're really small, and I don't know if it's just been me and I've been doing it like incorrectly, but I've always kind of just given paper scripts most of the time, just probably because of my circumstances and the high like triage and stuff of needing it like there not to be any miscommunications. So my family's just always kind of done that. So I was kind of just in the last few months calling physically myself to like Walgreens, then to them to like get stuff initiated. And maybe I shouldn't have been doing that, but it didn't seem like when I saw dermatology last and I asked them to like send it over to them and things that they could like just click something and it went. Just like with Walgreens, they would be like, oh yeah, sure, it's sent, and then.
No, here we can click and send.
Oh, it's working?
Mm-hmm.
Okay, all right, never mind then.
Yes, yeah. I think we're good for electronic.
Okay,
and
so
then,
they're using Epic as well.
Yeah.
All right, good.
So I think we're good. Okay. So we have the pharmacy situation kind of figured out.
Yeah, that was the big thing.
With the seizure medication.
Yeah.
Okay, good.
Yeah.
I know you saw.
Well, wait, I'm not sure if we're at the right scheduling for the seizure medication.
Okay.
Dr. Lenajek was very concerned about that.
Okay.
I'm supposed to be on a 90-day supply.
Okay.
He doesn't want me to continuously be on the 30-day supply.
Right.
I was given another 30-day supply this past week or so. That's a problem because it always ends up causing me to have the medication like not for a week.
Right.
Because if it's just for some reason valproic acid takes a while to order and like make sure it's correct for some. I don't know if it's like something with it.
That might be I'm looking back at the prescription.
When I spoke to Medicaid, the state level in the past month or so about that. They changed the Medicaid rules on June or July 1st and made everybody on Medicaid and Medicare and any federal stuff have to redo the like necessity for the 90 days. And
your Depakote
I
is
should
written as a 90-day prescription.
Could you like resend that as a 90-day?
But probably what happened is that they didn't have 90 days worth of Depakote in stock at the pharmacy, so they could only give you 30 days.
That's a problem. They can get the full 90-day stock. They just have to like order it. 'Cause I think they have to order it even if it's the 30-day, because it's not something they usually would carry at all.
Right.
And that's the kind of the problem.
Right. So the prescription doesn't need to change. The prescription is in as 90 days.
So the next time I get it, because I was told the next time I would get it filled, which was last week, it should have been ordered as a 90 days automatically, like what you're saying.
It is.
But it didn't.
So I think that's a pharmacy issue or a stock issue with.
But how it's like written there on the console,
is for 90 days.
Okay.
This is definitely for 90 days.
It's not like 90 days, but like if you don't have stock, then 30 kind of a situation.
I mean, we can't make them give 90 days if they don't have 90 days. You know, like it's ordered for 90 days, but if
they're supposed to be provided like the money
Correct.
to like get the 90 days.
Yes. So it's probably not a money thing. It's probably a preparedness thing, if that makes sense. So especially if this is the first time you've gotten the medication from that second time.
That was like the big thing with it. I got, or actually this might be the third time, and the second time I was supposed to automatically be put on 90 days, and that's what the state told me in September.
Yeah. So that is the pharmacy needs to be aware that they need to keep 90 days supply of medication in stock for you.
I don't know if that's even possible with the valproic acid because of how it works. They might have to like order it right when it's initiated for a refill for me, and then me like immediately pick it up.
I don't know about that.
I don't know if they can just keep it sitting there.
But you know, when you
I'm not like sure, but
they should be able to anticipate, you know, that in 90 days you're going to need another 90-day fill and have that ready for you.
I guess it's just kind of been like one of the only medicines I've ever taken that's been this way.
Yeah.
Everything else has worked like the way you're saying, but this, I should probably have just asked Dr. Lunchik more about it, but I didn't really think about that in that context. I'm gonna try to keep that in mind.
So you have dermatology. I know there was a spot. It looks like that you called them about, and you see them on the 25th.
Yeah, they weren't very concerned about the spot. It was probably just allergic reaction or something. I was having a lot of odd allergic reactions to, I'm assuming, some sort of like allergies thing. Maybe they're cutting the grass and it's a different type of grass now that I'm living somewhere else. It was pretty bad. My skin was having issues. So that's when I like took the photos and stuff. So I think it's probably not a problem.
Okay. You see gastro tomorrow?
Wait, I do?
Yeah.
What?
Never mind. Sorry, it was canceled. That's canceled. Just kidding.
Oh,
you do
I
not
didn't.
See gastro tomorrow. You see them in January.
I mean, that wouldn't have been a problem to have had it tomorrow, but.
Nope, it's in January.
Oh, okay, good. 'Cause I thought I looked at my the patient portal correctly, but I
did.
never really rely on that if I'm having seizures and stuff. No, it's fine.
So for me.
Oh, can you send to Mail Pharmacy 2 a new prescription for the dicyclomine?
Yeah, that's no problem.
Okay, 'cause that I don't have, and that's been like an issue for them to get.
No
I think
problem.
they need a physician to physically send them it in the first place.
Yes, agreed. I can do that.
I got my dentist to send them a like new recurring script for the prescription mouthwash.
Good.
So that's all handled. That was kind of a back and forth thing, but that's situated. Oh, could you send a script in as well for vitamins? 'Cause they were covering vitamins for me there, like just daily multivitamins.
Yep.
And I was when oncology tried to do it for me, they ended up having it sent back to them that they needed my general practitioner to do it. I don't know what generic vitamin I was being given in a pharmacy like last month, but I didn't get it this month, so I think I don't have a script in again.
No problem, we can do that.
I think that, what is it, just still coming I think that was it.
The only thing other than, did you get your flu shot?
No, I need
There's
that.
a new COVID shot.
I need that too.
Okay.
Yeah.
We'll do those.
And she mentioned the blood test for the HIV.
Oh, yeah. That's just, do you wanna have that done? I don't think it's necessary.
Yeah, more blood work's always good.
Okay.
For cancer patients, typically. I haven't had blood work in a while, and usually it ends up coming up as why didn't you have blood work, for the last 6 months or so. They used to just rely on me having recurring appointments for various things to get done.
The other thing, just your weight is low. It's always, it's always been low. I know
Yeah,
you were.
I saw it was 106 today.
Yeah, which is stable, from where it's been.
I'm surprised I haven't lost more weight, honestly, because I haven't been being supported by my parents at all.
Yeah.
They've been getting worse, but
Yeah.
I've just kind of been ignoring them.
Wondering.
But I've been doing a lot better with my diet since I've been getting a handle on how to budget with SNAP and stuff.
Yes, right.
Since I got that, but money's still kind of a pretty big issue with that. But I think I'm getting better at that and cooking within that context.
Have you seen a nutritionist in the past?
You guys tried to get me into one a bunch of times.
Yeah.
Children's Hospital was trying to get me into one for 10 years, and since the transition period for building this facility was underway, they kept shifting around the nutritionists from different facilities. I'm gonna try to do that again. So if you know of where they're actually at,
I think there's one at the cancer center, so I'm gonna put in.
Okay, yeah, put in something for that then, because last time I talked to Dr. Bolme, he said the same thing, and I don't think he knew where they were again.
Yeah, so I'll work on that. Deep breaths. Can you feel your neck here?
My lymph nodes were very, very swollen a few weeks ago when I was having the strange allergies. I don't usually have symptoms like that, to the extent where I think I passed out a couple of times.
Okay.
But I didn't hit my head, so I think it was okay.
Okay. All right. So we've got flu shot and COVID shot, lab. Okay, so I'm gonna go work on your prescriptions. They're gonna bring your flu shot and your COVID shot in here. We're calling your pharmacy about which medication needs prior authorization.
The new prescriptions for the dicyclomine and the lidocaine?
Yes. And we are, I'm gonna work on a nutrition referral again.
Okay, thank you.
Okay, you're welcome. Okay, hang tight right here.
didn't know I was coming in with the shots.
Oh, okay.
Alright, so this is just...
Sorry, I couldn't really hear.
Understandable. So she got you taking some lidocaine. She changed some of your medications. You pick them up on the pharmacy in Mandeville, right? Highway 90. She ordered the test she ordered was the HIV test, which is lab work. So it's quick stuff. And it's blood work, and then if you have the portal, you'll see it on the portal also.
Okay, and then I'll just come back to the hospital and have it done there?
No, you gotta be done. You can have it. If you want to do it today, you can. If you want to wait, just go to the big hospital first.
I'd rather do it today, yeah.
So,
do I have to walk over there to do it, or can I just have it done, like...
Here.
Oh, just here in the building?
Excuse me one moment.
Okay.
Sorry about that. Wait, do you have any serious reactions to this before? Any serious reactions?
No, I don't think so. None of, like, the, like, shortness of breath or, like, closed throat or anything that I remember being told. So, I've been fine. Been very fortunate.
what side? Look,
Oh,
left or right?
sorry.
Yeah, you right here.
Left, right, so I guess left or
Wait, what thing?
No, I'm right-handed.
Okay, you put it in your left. Okay. I think you can think about
none
of this
okay.
money,
I'm
huh?
out of this. It's fine. You need it subcutaneous?
Right here.
Okay.
In your deltoid.
Alright.
I mean, if you can just, if you could slide it down, that's fine.
Nah, it's alright, I'll just take it off.
That's fine.
Is it fine?
Yeah, it's just slide it. It's crazy how you so relaxed. Everybody be like,
Oh, I mean, I had
you used to it by now, right?
multiple daily, I don't know, hourly injections back when I started cancer treatment. So I mean,
Oh, you
I've
got
kind of
cancer
just
too?
yeah, so I've just kind of grown up like this. I get that a lot though. Most of the nurses end up saying something like that. But most of us are kind of just grow up that way. It's really just normal, like especially when they take blood and stuff.
Right.
We just like know what to do.
At that point, right?
Yeah, I mean, I got probably the last time I had blood drawn earlier this year. The nurse said basically the same thing. I just immediately got my like wrist out, like ready to go without even thinking about it.
Right. There you go.
Take the last one?
Yeah.
Okay, cool.
Just stop at the front desk and get your next appointment with Dr. Linden.
And blood work stuff automatically.
Yeah, so just stop at once you get it done, it's gonna be on the portal. Now if not, sometimes will call. She'll call you. But stop at the front desk, get your next appointment. They'll put you in lab waiting, just sit in the lab and the lab tech will come through your blood work in here.
In here. Okay.
In here, yeah.
So I just stay in this.
Yes.